Hi, good afternoon. My name is Audrey, and welcome to another Ask Asian Eye Facebook Live session. So, as everyone knows, during the enhanced community quarantine, we all stayed home. And the reason for doing that is that we wanted to keep our families safe. And now we are seeing that cases are still on the rise, so it's even more important for us to stay careful and mindful about the places that we visit or whether we go out at all. And so one of the things that we decided to do is we started to offer teleconsultation. So yung teleconsultation kasi medyo bago siya sa pandinig ng mga tao. So what we're gonna do this afternoon is we're gonna have one of Asian Eye's teleconsult specialists, Dr. Ralph De Jesus, to explain what teleconsultation is, how we do it, and how it can benefit patients like you. So first things first, Dr. Ralph De Jesus is a cataract and comprehensive ophthalmologist, and he specializes in retina and vitreous diseases. So he got his medical degree and internship from the University of Santo Tomas, and then he pursued his residency training in ophthalmology at the Cardinal Santos Medical Center. And then afterwards, he joined Asian Eye's Medical and Surgical Retina Fellowship Training Program, and that was done under Dr. Amadeo Veloso, Dr. Patricia Calendino, and Dr. Cheryl Orsino. And he's also a diplomat of the Philippine Board of Ophthalmology, and he's actually published several scientific papers under his specialization. So hi, Doc. Good afternoon.
Good afternoon, Audrey. Good afternoon, everyone. Thank you for tuning in once again.
So today, Doc, it's actually a very rainy Tuesday. So we're glad that a lot of people have decided to tune in. So first, we already know that we're in the middle of a COVID-19 pandemic. So a lot of the patients are either postponing or they're avoiding doing eye checkups because they don't want to go out. So can you tell us why teleconsultation is an alternative and how is it done?
First of all, teleconsultation would offer patients a convenient way to talk to their Asian eye doctor. Also, you can get e-prescriptions, so you don't need the actual prescription anymore through this service. And also, a medical certificate can be given to the patients. So there's really no need to go out as long as it's not an emergency. So you can always stay home, but still make sure that your eyes are healthy.
Okay, that's good to hear. So what Doc mentioned is first, you can get the checkup done. Second, you can get an e-prescription. So if you need medication, then you can just bring the e-prescription to your nearest drugstore, or maybe send it through email to your drugstore and have your medication delivered. And then third, let's say you needed a medical certificate for work, then that's something you can also request for through the teleconsultation service. So Doc, kapag nagpapakonsult ba, how do you check the eyes?
It's always via video calling, no? So there's audio and video.
So what happens, Doc, is, syempre medyo mahirap kasi minsan i-explain, di ba? Kapag may nararamdaman ka sa mata, kapag nasa phone ka lang, medyo mahirap i-explain doon sa doctor kung ano yung either nakikita mo or nararamdaman mo. So, does that mean na pwede kong picturean yung mata ko and send it to you?
Especially if your concern is with the appearance of the eye, no? Mas magandang picturean kasi yung actual video natin, I noticed, hindi siya ganun ka-clear eh. Kahit lumapit yung patient doon sa camera niya, hindi masyadong clear. Pero pag sinesend yung video, it looks better. Yung picture, it looks better. Mas maganda yung resolution. So we are able to see better yung problem ng mata.
Okay. So that's the thing with the online portal that we use. So when you log onto it, you're able to schedule your appointment and you can send in a photo of the way that your eye looks. And then we have like a coordinator who kind of walks you through the process. So you're not worried about, am I doing it right? Tama ba yung angle ng picture? Or is it clear enough? And I think you're right, Doc. Like for example, ngayon, nagbe-video call tayo. So, although we're clear, if I were to even come near to the camera, parang mahirap naman makita kung merong problema sa mata.
Correct,
so,
yes.
And I guess, Doc, that would be dependent din kung gaano kalinaw yung camera mo. What if you're using a phone camera, right? So, if it's a higher resolution phone, then sure, no problem. Pero let's say it's an older model or you're not familiar with how to use the camera, may difficulty if you're trying to bring your phone closer to you just to get a nice view of the eye. Okay, so another question siguro that we would get about teleconsultation is, Paano naman, Doc, kung urgent or emergency case siya? Pwede ba siyang through teleconsultation?
First of all, kailangan muna natin i-define kung urgent or emergency ba yung case ng patient, no? Kasi minsan, akala nila namula bigla yung mata, emergency na kaagad eh. Pero hindi naman lahat ng redness or mga symptoms na nararamdaman ng patients is an emergency. So it would be nice mag-teleconsult muna and then let the doctor assess if it's really an emergency. And then if we find out that it's really an emergency, the doctor will be the one to tell you that you have to go to the ER of any hospital or to Asian Eye to seek consult.
Okay. So what we're able to do here is that pag minsan kasi any sort of irritation in your eye or redness or even pain, parang immediate, oh my God, I have to see the doctor. But
Yes.
what you're saying here is actually no. Yung don't panic. The first thing you can do is actually call Asian Eye and find
Yes,
out.
correct.
Kasi what we're trying to do is to keep you from having to do an unnecessary trip outside of your home.
Yes.
Okay. So here, Doc, similar to when you go to a clinic, diba? You can go there or you can call and you can say, I want to see, say, Dr. De Jesus. Pwede rin ba yon sa teleconsultation? Can I request which doctor to consult?
Yes, you can request for whoever doctor you want to see, no? And then if it is your first time doing the teleconsult or first time in Asian Eye, we will be able to deck a doctor for you depending on your eye concern, no? Kasi yung mata natin, maraming subspecialties yan eh. So whoever is the best subspecialty doctor for you, we will deck that doctor for you.
Okay. So at least you're guided about which doctor can help you with your particular problem. Okay.
Yes.
And then, when it comes to teleconsultation pa, Doc, open lang ba to para sa Asian eye patients? Or kapag first time ever ako gusto magpa-consult ng eye doctor, can I use this service?
It's open to everyone, no? So we welcome anyone, our old patients as well as any new patients.
Okay. And that's good to hear kasi I'm sure there might be some people who haven't visited their eye doctor for a long time. So at least they know, lalo na siguro, Doc, kapag immunocompromised, no? Para hindi talaga sila kasi lumabas-labas. So it's a good thing that they can use teleconsultation. And then when it comes to payments naman, Doc, I'm sure some people are wondering, how do I pay my doctor if I'm doing a teleconsultation?
Payment can be done by credit card or you can also do over-the-counter payment. No? So or you can also do online bank transfers through BPI or BDO.
Okay. So at least here, we also know that we have options. Kasi we're applying like a pay before consult kind of situation so that you're able to send in your payments already for the set price for the teleconsultation. And then, and it can be the same day. So the same day that you want to have it done, you can already process it.
Yes.
Okay. And then, Doc, since this is a new service, maybe another question that a lot of patients might have is, gaano ba ka-safe or ka-secure yung data ko as a patient when we use a teleconsultation service?
Okay. So even before the teleconsultation, Asian Eye already has a stringent data privacy policy in place, no? So this data policy can be viewed, no, on our website. And for teleconsultation patients, we only proceed once the patient consents and understands this policy. So you don't have to worry about privacy issues.
Okay. So that's good to hear kasi one thing that I'm sure a lot of patients are careful about is, di ba parang we hear a lot of those people who get random calls from numbers requesting for data, and we don't want our patients to have to go through that. So that's why we have our own portal and we have our own system so that you know exactly what the process is. So it's something that we post on our social media and on our website, and you're guided like every step of the way. And then, Doc, ito. So, kunyari, nag-decide na ako. I want to teleconsult with you. So, what do I need to prepare before my actual consultation?
So, first of all, just like any clinic consult, no, kahit hindi naman teleconsult, it would be nice if you can write down everything. Kasi minsan, pagkagaling natin sa clinic, uuwi tayo, sasabihin mo, ay, nakalimutan ko tanungin kay Doc, yung ganon. So, parang hindi ka mapakali, no? So, it would be best, first of all, to write all the symptoms you're experiencing, no? It would be nice to write a short history lang when you started experiencing these symptoms, how often, and what causes relief of these symptoms. Tapos, again, it would be nice to write all the questions that you have for your doctor already para hindi mo makalimutan lahat. And then lastly, we also want to know not just your eyes, but systemically, we want to know if you have any other comorbidities or other sicknesses. And of course, the medications you're taking for these sicknesses, no?
Okay. So siguro, when it comes to eye health kasi, people don't realize that the state of your body, so your general health condition, actually has an effect on
Yes,
your eyes. So for
yes,
instance, I think this is something you've said before, na basta't mataas yung blood sugar mo, that can affect your eyes, or
yes,
kunyari, mataas ang blood pressure, blood sugar, or let's
yes,
say you have a
correct.
sedentary lifestyle or if you smoke. So those are some
Correct.
things that would affect your eyes also. And then
Yes.
siguro, for how about naman when it comes to technology, Doc? Like, what would I need to prepare to make sure na malinaw yung pag-video call natin?
Mhm. First of all, of course, you need a gadget. Any cell phone would do, or even a laptop would be better. And then you have to have an internet connection with at least 1 Mbps speed, no? So that the connection would be uninterrupted and then hindi nagpipixelize. Next, you would need a properly functioning camera and a microphone. And then ideally, it would be best if you can stay in a room which is private and quiet. And then you should download the latest web browser or we use an app, the Continuous Care app. That's what we use for the teleconsult.
Okay. So here, like the way that I'm listening to it, it's a lot of the requirements for you to make a regular video call are the same for doing a video
Yes.
consultation. So more or
Mhm.
less, if you've done a video call before with your family at home, then definitely that means na kayang-kaya to use the
Correct.
teleconsultation service of Asian Eye. And
Yes.
siguro, depende na lang sa inyo yon. Like Doc was saying, you can either download the app, yung Continuous Care app, so that you can log on to our portal directly. Or just we'll send you a link to your email, you click it, and it goes into the browser. And then dun lalabas yung options that you're gonna click through and you're gonna just fill up right before your teleconsultation. And then, what's interesting, at least for me, siguro as a patient, one of the things kasi when you're trying out a new service, parang tama ba itong ginagawa ko or did I miss a step? So yung maganda kasi dito, merong telehealth nurse coordinator na tatawag muna no, Doc. Right before I
Yes.
talk to you, there's someone
Mhm.
else that helps me with my
Yes.
requirements.
Mhm.
Okay, and then, so, ano ba yung difference between a teleconsultation that we're doing versus getting an eye checkup at a clinic? Would you say na para silang interchangeable? You can do one instead of the other?
Of course, this is very different, no? You cannot compare what is yung actual going to the clinic and a teleconsult, no? Um, Ideally, I would say that I would like to see the patients in the clinic pa rin,
Mhm.
but given the circumstances of this pandemic, no, if it's not an emergency, it's really better to stay home. That's why we offer this alternative of having telemedicine. First of all, when you go to the clinic, you have your eye grade check before you go to your ophthalmologist. So that's one thing we can't do with online services like telemedicine. The eye grade tells us a lot of things about your sickness already. So that's one downside. We can check your eye grade.
Mhm.
Also, when we see you in the clinic, we use this machine that we call the slit lamp. It's something that magnifies the patient's eyes. It's something that it's impossible to do during online consults. So that's another downside. Um, Next, there are diagnostic tests that we do, which we can't do online also. These diagnostic tests would give us a baseline on what the patient is experiencing even before the symptoms occur. So, teleconsult is really not as good as seeing the patient in the clinic. No?
Okay. So the way that we're looking at it, parang it's a good alternative for patients that simply cannot go out, right?
Yes,
And
correct.
minsan kasi like you were saying, pag minsan the concern could be something minor. I read
Yes.
this that might have been,
Mhm.
let's say, napuwing ka or madalas ka nag-work from home. So that means there's additional fatigue to your eyes or baka naman you have kids na naglalaro and
Correct.
medyo roughly natamaan yung mata. So those
Mhm.
are things that could cause some eye irritation or maybe some And what we're avoiding, syempre, any sort of eye injury. So
Mhm.
teleconsultation allows you to talk to your doctor, and the doctor can assess. Sasabihin niya naman sa'yo na parang, alam mo, with the way that it looks, the way that your symptoms are sounding, mas mabuting magpa-check up. Tama ba yun,
Yes,
Doc?
correct. That's correct.
Okay. So at least it's an alternative. Parang it's your first step. It's literally like a phone a friend where you can, and
Yes, correct.
third, you can phone your doctor.
Mm-mm.
And at least you won't have wasted a trip out.
Mm-hmm.
If you
Correct.
really do need to go out, then they can come to the clinic and we'll have them scheduled. Kasi what we want to do is that kapag kailangan naman talagang bumisita, at least marami tayong safeguards in place
Mm-mm.
and malinaw sa inyo, sa patient, kung bakit gagawin yung visit na yun. So
Mm-mm.
yeah, it's good
Yes.
to know, Doc, that there are some differences and there is, at the very least, an alternative before we have to do a comprehensive eye exam.
Mm-hmm. Yeah.
And then how about when it comes to the actual process? Kasi you were saying, Doc, na marami naman tayong pagdadaanan ng machines or processes when you
Mm-hmm.
do comprehensive eye exams. Ano tong mga tests aside from the checking the eye grade and you were saying
Mm-hmm.
the slit lang?
Okay. So aside from the interview with your doctor, you ask the patient's history of the patient's problem, the complaint. After doing a thorough eye examination, if there is a need to do diagnostic tests, we would request these diagnostic tests. But not all the time there is a need to do these tests. No, usually these are done in patients who have um, a severe disease already, or if you we want to see something more of the patient's disease. So tests are usually done with machines wherein you put your chin on the machine and then we take pictures of your eye. Sometimes we also need to use a dye that we inject in order to see a better progression of the disease or a better visualization of the parts of the eye.
So, Doc, when you're saying naman that we have to do like more comprehensive tests, that's after, let's say, your initial checkup and parang napapansin mo na as the doctor na I think maybe the vision of the patient is affected by another condition, whether it's diabetes or whether it's high blood pressure, yung mga ganon. That's what you would need the additional test for.
Yes.
Okay. But yung initial checkup, when it comes to just making sure that the eyes are healthy, ang
Uh,
tinitingnan nyo, yung labas lang ba yung ng mata or pati yung loob, i-check nyo na?
mas maganda kung makita natin pati yung loob ng mata. But when we do the checkup, that's called dilating the eye, no? When we check the back part of the eye, the vision would become blurry for about 3 to 4 hours. So it would always be nice to bring a companion with you because you would have a hard time going home if you'll be going home by yourself.
Oo. So siguro that's a thing that people have to take note that should they have to really come in for a checkup or if you're accompanying a friend or a family member to the
Yes.
clinic, if it sounds like they do need to have like a very comprehensive check,
Mhm.
to have that companion along. Kasi at the
Yes.
very least,
Correct.
mahirap mag-drive kapag blurry ang mata. It's not
Yes, correct.
safe.
At saka
Oo.
hindi safe, yeah.
Oo, oo. Lalo na ngayon. I mean, I'm
Mm-mm.
sure there are fewer people on the road,
Mm-mm.
but hanggat maaari, ang gusto nating siguraduhin na safe makakauwi yung pasyente.
Yes. Mm-mm.
And then here, Doc, syempre, ang one thing that I've noticed sa mga pasyente natin is that
Mm-mm.
ayaw mong magpa-check unless meron ka na talagang nararamdaman na sintomas. Bago ka
Mm.
talagang either tumawag sa doktor mo or magpa-schedule ng appointment. Ano
Mm-mm.
yung ina-advise, kailan mo usually ina-advise ang pasyente na magpa-check up na ng mata?
Okay. Actually, yung ganyang mentality ng patients hindi lang sa eye problems eh. Actually, generally ang patients pag walang naramdaman, hindi nila iisipin na kailangan nila mag-check up regularly, no?
Mhm.
So, when it comes to the eye, the questions that you have to answer is first of all, are you 40 years old and above, no? So, as we grow older, diyan lumalabas kasi yung mga problems eh. So, dapat mas nagpapa-check up tayo. We watch our health, we become more health conscious as we grow older. Next is yung mga patients na may family history of eye problems such as glaucoma or mga macular degeneration kasi most of the diseases namamana yan eh. Just like
Oo,
diabetes. Mm-mm. Yun, no? So, and then another very common eye problem is yung mga patients na may diabetes and high blood. Akala nila basta controlled yung blood pressure, yung blood sugar, everything is fine, no? Pero sometimes, when we check the eye, sasabihin sa akin ng patient, controlled ng maintenance, lagi ako nagpa-follow up, pero pag check ko ng mata, may problem eh. So, kapag meron kang mga comorbidities or systemic problems, it would be better to always see your doctor more frequently. And then, of course, patients who have had previous eye injury or surgeries, they would need more frequent follow-up with their eye doctor. And then, the most common, yung mga patients na may eyeglasses or nagko-contact lens, kailangan nagpapacheck din tayo lagi. And then, lastly, patients may be taking medications for systemic problems such as yung mga nagsisteroids or yung mga dito sa atin, very common ang tuberculosis. May mga side effects kasi sa mata natin yung mga ganyang gamot. So, it would be better to see your doctor more frequently.
So Doc, dun sa mga sinabi niyo kasi, yung parang tumatak sa akin. So, pag minsan, kahit na kontrolado yung blood sugar mo, or you say that you're taking your maintenance medication for blood pressure, na there can still be damage to the eye. May
Yes,
kinalaman ba
correct.
to, Doc, dun sa gano'ng katagal ka na rin with that condition?
Yes. Actually, may study with regard to diabetes, no, na even if you have very good control, basta meron ka ng 20 years or more with diabetes, meron kaming nakikita sa mata eh.
Okay, so that's a good sign, and it's a good reminder for any patient that has these conditions that when you're gonna get your regular checkup na rin with your diabetologist or your heart doctor, more or less it's also an indication that you also have to see your eye doctor para lang you have a holistic view of how your body is doing talaga.
Correct. Yes.
And then, Doc, paano naman for kids? Can I also use, can I use the teleconsultation for my kids? And how often is it that I would have to bring my child for a checkup?
When it comes to children, no, it's more important that we see them early because prevention is always better than cure. So usually we recommend an eye exam as early as 6 months of age, at age 3, and before they start going to school. Kasi yung mga problems in children, if you don't catch it early, it can lead to permanent eye problems in the future eh. Yung mga hindi nagde-develop yung mata dahil napabayaan ng bata sila. Also, yung mga patients na mas binabantayan natin is yung mga patients na may history ng premature birth or low birth weight nung pinanganak, mga patients with developmental delays, or those who, minsan kasi yung mga bata, akala mo okay sila, pero I'm sure mapapansin mo minsan nagsisquint sila or yung pinipikit nila lagi yung mata nila when it comes to focusing or reading. Pag ganun, dapat ipacheck yun. Tapos, another thing na common din sa mga bata, yung tinatawag naming strabismus or yung may mga cross eyes. Pag ganun, you have to see your eye doctor right away. Also, same as with adults, yung mga patients na may family history of eye problems, no, glaucoma, or common sa mga newborn infants is yung baka may family history ng retinoblastoma, no? It can be cured pero it should be caught early. Sayang naman. Another thing is yung mga batang nakasalamin or yung may mga mataas na grado. Yan, mas often dapat sinecheck yan, mga twice a year. And then, yung mga bata na nagko-contact lens din, better din na mas ma-check sila more often.
Okay. So, when it comes kasi to kids, siguro, Doc, yung sinabi niyo kasi na kapag nagko-cross-eye yung bata. So, pinag-uusapan natin dyan yung mga may tendency na magbaduling at saka yung mapanlag. That's right. So,
correct.
In those cases kasi, Doc, usually may kinalaman kasi yon dun sa ability ng eyes to kind of work together, no?
Yes.
Na, it could be due to high eye grade. And posible ba, Doc, let's say, sa family naman namin, wala naman talagang nagka-problema with cross eyes, can it still manifest in my child? Ganon.
Pwede rin. It can happen.
Okay. So, things like that. So, siguro, obviously, for a parent na nagsasalamin na nagka-contact lens na, mataas talaga kasi yung likelihood na kakailanganin ang salamin ng anak.
Yes, correct.
The one thing that you have to watch out for is that if you have an eye concern, malamang your child will likely develop it as well. So, if they develop, ang gusto nating mangyari is maagapan natin ng maaga.
Yes.
So, whatever intervention is more effective habang tumatanda yung anak mo. Okay.
Yes, correct.
And then, Doc, you were talking about other conditions that baka you won't even notice signs agad. Siguro yung, I know that the childhood cataract happens pa rin. Is that something that is immediately noticeable? Let's say, kung pinapapedya ko naman yung anak ko, mapapansin ba yun?
Usually, pagkita mo na siya or pag nakikita na ng pedya mo, medyo makapal na talaga yung cataract nun eh. Usually, it's a white cataract na kitang-kita na natin. Pero pag nagsa-start pa lang, you can't see it with the naked eye, no? And usually sa mga bata, common ang cataract is, one is congenital cataract, no? And then the second, common yan kapag natotrauma yung mata eh. Lalo na sa mga bata, common na napopoke yung eye or nagkakaroon ng injury to the eye. Minsan nagkakos talaga siya ng cataract. So any trauma to the eye, mas maganda kahit na okay naman yung vision, ganon, mas maganda makita sa clinic pag ganon. Kasi baka may nagsa-start na cataract, no?
Okay, so I think that's very important information kasi siguro marami namang magulang na kapag naglalaro yung mga bata, minsan talaga hindi nila maiwasan yung merong matamaan sa mata. Lalo na kapag nakaglalaro sila anything na may bola or sharp-edged object.
Yes.
Or minsan yung nabunggulang sa edge ng kama. Yung mga ganon.
So, yung mga accidents na ganon.
So yung mga ganong aksidente naman, syempre aksidente siya, hindi naman natin inaasahan. So mabuti na rin na mas manigurado ka na, ipa-check mo na sa doctor mo. And then, Doc, when you're talking about yung mga bata na let's say, if it's, kung sanggol pa lang, kung baby pa lang, basta premature yung bata or low ang birth weight, it's always a good idea na, sige, pa-check mo na regularly para lang to check kung tama yung development ng eyes niya.
Yes, that's correct. Kasi meron tayong condition na tinatawag na retinopathy of prematurity. Very common yan sa mga premature children, no? It's treatable, it's curable, as long as you catch it early in the disease. Kaya lang pag napabayaan, pag hindi natin na-check agad, it can lead to blindness. Sayang naman yung vision ng bata kung na-prevent natin sana yung blindness dun sa bata.
Okay. And then, docs, so for this, let's say I've decided I want to get this teleconsultation with you. What do I need to do? What is the process?
First of all, you can easily call us. No, I think they will be flashing on the screen yung mga hotlines ng Asian Eye Institute. Tapos, this is a new thing dahil because of this pandemic, we now require the patients to undergo COVID-19 screening for the safety of everyone. And then, as much as possible, we would request the patients to arrive on time because we try to limit the number of people in the clinics. No? Kasi we want to maintain social distancing and also you want to get into the clinic and then get out as soon as you can. Just to, nakakaparaning kasi ngayon eh. So, and also remember, you can bring only one companion pala during this time.
Okay, so siguro that's particularly useful to know for parents. Kasi ang tendency kapag dadalhin mo yung anak mo, you as the parent with the child, and often you want to bring a yaya, like another companion. So siguro it's important to remember that at least for this time, kayo muna mother and child, parent and child. And since we do limit the number of people in the clinic, you're probably not going to wait that long anyway. So we expect that we'll be able to get you through the process much faster. And then again, we're just, remember, of course, siguro the thing that people might forget is that just because you're inside the building, it's actually more important for you to wear a mask.
Yes, correct, yes.
And you have to keep it on the whole time, even during your actual checkup. Some people forget kasi na, they're in front of the doctor and then may tendency to either move it down or to remove it. So no, we're actually encouraging you and it's part of our own protocols na kapag harap mo si doc or any of the other medical professionals, just to keep you safe, tsaka yung everyone else in our community safe, you keep your mask on.
Correct,
and then you know what? We actually have quite a number of questions from the people that are watching us today. So una naman, first question doc, from Aline Alejandro. 2 days ago, sakit ng kaliwang mata after ko mag-cellphone. Dati kahit matagal ako mag-browse, walang ganitong feeling. Then I noticed medyo namumula at nag-worry nga kasi yung ate ko na nagkaganto rin, mas worse yung sa kanya kasi pumutok yung ugat sa mata niya. And it takes more than a week bago gumaling kung di pa-check up sa eye doctor. Ako naman, okay na mata ko, nagsusuot na ako ng anti-radiation glasses. What will I do para di na maulit ang nangyaring pamumula at pananakit ng mata ko? Lalo na work from home po ako, halos buong araw nakaharap sa laptop at cellphone.
So during this time of the pandemic, no, very common yung ganitong problems kasi day in, day out, nasa bahay lang tayo, either nagti-TV, computer, gadgets. Even if we're working, nakaharap pa rin tayo sa computer or gadgets natin. So ang very common na pwede mangyari sa mata natin kapag ganito is yung tinatawag na eye strain or dry eye. Sa tingin ko yung nangyari kay Ma'am Alejandro is a case of dry eye kasi na-notice niya yun after niya nagsi-cellphone, no? Ang pwede natin gawin, she can put lubricant eye drops. Usually over-the-counter lang naman yung mga lubricant eye drops. Ginagamit natin yan 4 to 6 times a day. At saka kung maaari, i-minimize natin yung time natin sa screen or sa TV, gadgets, ganyan. Pero kung hindi talaga may iwasan, what I tell most patients is gamit na lang tayo ng eye drops.
Okay. So, yun, those are good tips. At least we know that kapag alam mo nang magdamagan ka, kailangang nakaharap sa laptop, either ipahinga mo, I think, Doc, meron pa rin tayo ng 20-20-20 rule, no? So every 20 minutes ng work, ipahinga mo ng 20 seconds yung mata mo by looking at something 20 feet away. Would you say that's something that would be useful for someone na nag-work from home?
Yes, it would be useful para napapahinga din yung mata. It also prevents dryness at saka eye strain. So you could do that.
And then siguro like what people forget kasi na kapag nakatitig ka sa screen, nakakalimutan mong mag-blink. No?
Yes, that's correct.
No?
Actually, not lang sa screen. When you're actually doing something that really needs your focus, bihira ka talaga mag-blink which will lead to dryness of the eye.
So yun siguro ma'am, baka something we need to watch out for. So either you rest, lagyan mo ng timer yung cellphone mo na every 20 minutes or so, you get up, you blink your eyes or you rest them.
Yes.
And then kung kailangan na talaga, eye drops.
Yes. Another thing, pag nasa bahay tayo, minsan nakatapat lagi sa atin yung electric fan or nasa air-conditioned room tayo, mas prone mag-dry yung mata pag ganun.
Dahil sa air condition.
Yes.
Also. And then, Doc, you said that over-the-counter yung eye lubricants na ganito. If they needed it, Doc, they could also request for a prescription from you?
Yes, we can give a specific prescription if they really need it.
Okay, sige, siguro yun. And that's a good reason to use the teleconsultation function also.
Yes.
So, next question, Doc, from Ms. Rachela Tupas. Hi, may age limit po ba for LASIK procedures?
Usually, we give that to, hindi siya pwede sa mga bata, yung batang-bata, kasi nagbabago pa yung grade ng bata. Hindi rin siya pwede sa masyado ng matanda kasi nagsa-start na magkaroon ng cataract. So, kumbaga, hindi mo makukuha yung full benefit ng LASIK procedure. Usually, 21 and above, pwede na. Tapos, I think around age 30 or 35, pwede pa. And then, when it comes to, when you reach age 40 kasi, nagsa-start ka ng kailanganin yung reading glasses kasi nagkakaroon na ng difficulty in focusing yung mata natin. 40 and above, no? May bago tayong procedure na laser din siya sa mata that corrects this need for reading glasses. So, kung ayaw mong mag-reading glasses pa rin, even if you're getting older, you can inquire in our clinic to see consult if you can have this kind of procedure to correct the need for reading glasses.
Okay, so for ma'am, yung procedure that Doc is talking about is called supracore. So it's a type of LASIK that you can do with for reading distance. So kapag alam mo naman na gusto mo pang makatingin sa mga bagay sa malayo, that's for LASIK. Pero if you also know na meron ka ng reading vision, then the treatment can also be customized kasama po yung supracore. So ang kailangan nyo lang po dito is that you set an appointment, you get yung LASIK screening done para masabi sa inyo ni doctor kung nababagay yung gantong procedure para sa inyo.
Yes.
And then, Doc, here's another question. Doc, my problem is watery eyes. So baka itong watery eyes, Doc, medyo madalas.
Ano na naman yan? Very common yan. Again, because we are always at home, laging naka-gadgets, it's a symptom of dry eye, yung watery eyes. So I get it every time. Sasabihin niya, hindi dry yung mata ko, Doc, kasi nagluluha nga eh. Pero that's the wrong notion. What we explain to these patients is parang negative feedback mechanism yan ng brain natin eh. Napapansin ng brain na nagda-dry yung mata. So ang ginagawa niya, mas pinapaluhan niya yung mata. It also causes discomfort eh. So same with the first question, lubricants would help this condition.
Okay. So yun, that's again, it's good that it's over the counter, and it might be a good time also just to consult with a doctor in case you might have other conditions na might be
Yes.
aggravating it also. So pwede siyang pakonsulta sa inyo. And then, Doc, here's another question naman. Hello po, Doc. Meron po akong anak na 2 years old and 2 months. Kaso po, para pong may pagkabanlag po siya, hindi po kami makapagpa-check up due to pandemic.
With regards to this, no, kung yung mga patients na napapansin ng magulang parang nagbabanlag, nagko-cross-eye, ganyan, mahirap kasi gawin yan through teleconsult kasi meron kaming measurements na ginagawa dun sa mata ng patient. Doon natin malalaman kung ano yung appropriate treatment na gagawin. So, lalo na kung bata, as soon as possible sana, magawa natin ang paraan na madala yung patient sa clinic.
Okay, so for this particular patient siguro, ma'am, maganda po na padalhan niyo pa kami ng details, siguro kung where you're located, kung baka kasi malaman namin kung anong branch yung malapit sa inyo. And kung may pangangailangan rin siguro ng tulong para ma-transport to the nearest branch, let us know about your location. Baka naman there's something that we can do to help. And then here naman, Doc, next question is, my grandmother was diagnosed with cataract almost 2 years ago, but doesn't have time to have her eyes operated. Supposed to be this summer, but this pandemic happened. She has a few questions for you. Okay, Doc, medyo maraming questions.
Sige.
Sige, so the first question, paano po ang pag-operate? Both eyes at the same time or one at a time?
For the first question, ang pag-operate ng cataract or any eye procedure that we do in the operating room is always one eye at a time. This is because kung may mangyari na, usually infection kasi yan eh. Pag may infection na mangyari on one eye, automatic yung other eye magkaka-infection if we do it on the same time, on the same day. And then, so we are just minimizing risk, and we just want the safety of the patient. So we never do eye surgeries at the same time. It's always one eye, and then usually the earliest is after 1 week, and then we do the other eye.
Okay. So also at the same time, siguro for, ito kasi grandmother, no? So medyo matanda na. I'm sure very stressful kasi yung idea na both eyes at the same time.
Yes,
so,
yes.
So one eye at a time, para you still have your other eye to look through while you're recovering.
Correct. Yes.
And then maybe after a week or two, gagawin na yung pangalawa. And then hopefully by that time, the other eye naman is functioning well enough. So para maalalayan kayo for the recovery of the second eye.
Correct.
And the second question niya is the surgery outpatient or stay-in?
Usually in Asian Eye, we do all our eye surgeries as an outpatient basis. No? Usually the patient comes in the morning, we prepare the patient for surgery, we do the surgery, and then we let the patient stay in the recovery room for about 1 to 2 hours, and then the patient will go home. Checkup would usually be the next day, and then after 1 week.
So yun siguro, that's important to note na hindi naman kailangan magpa-check-in pa, walang overnight stay na gano'n na nangyayari sa atin. Kasi a lot of these procedures, especially in cataract, is one of the most common procedures, no, Doc?
Yes, very common.
Yes, for when it comes to any hospital, madalas talaga sila gumawa ng cataract surgeries. Kasi sa tumatanda, likely kang mag-develop ng cataract. So a lot of people go through it.
Yes. May special cases lang kami no, that we refer to hospitals wherein the patient needs to be in a hospital setting. Ito yung patients na maraming comorbidities, yung mga may heart condition, no, na kailangan bantay na bantay talaga sila. So pag ganun, we usually refer them to another hospital. Kaya very important yung medical clearance. Before surgery, we always request for the clearance. If the doctor says na cleared siya to undergo, low risk, so we do it in the institute. However, if sinabing high risk yung patient, kailangan hospital setting, we can't do it in our institute.
Okay. So at least, again, there's an alternative. For most patients, for as long as you get your medical clearance, it should be all right. And then if there's a need for a hospital, then you can be referred quite easily also. Ito, may another question. Maari po ba gamitin ang PhilHealth at senior citizen card
Yes, pwede gamitin ng PhilHealth and Senior Citizen.
Mm-mm. So siguro, one good thing to know is that when you come in for the checkup, nagpa-screen ka na, and yung next step mo kasi doon, kapag sinabi na ng doctor na, yes, we'll do cataract surgery, is that kakausapin kayo ng surgical coordinator.
Coordinator, yes.
So what the coordinator does is i-explain niya, sige, ito po yung quotation for you. Take into account yung PhilHealth benefit ninyo at saka senior citizen discount. Magbabago po kasi yung total at the bottom. So I think, if I'm not mistaken, ang PhilHealth benefit for cataract surgery is about 16,000 pesos per eye. So that's already something to keep in mind kapag siguro naghahanda tayo ng funds natin for surgery. And yung senior citizen benefit naman is about 20%. So when you combine those two, they'll show you what the total is. And may options naman para sa inyo when it comes to payment plans. So we do offer things like installment payments when you use your credit card. And then here, ito Doc, paano po ang pagpapaschedule sa inyo? When and where can we see you for an appointment?
So first of all, kung teleconsult, we can give you the schedule, no? You can call us anytime and then you can ask for our schedule. Tapos pag clinic schedule naman, ganun din, you can call us and then we will set an appointment with you. Also, it would be better yung malapit na lang sa area kung saan kayo nakatira para hindi na kayo masyadong babiyahe ng malayo.
That's right. In this case, what we'll do is i-flash din namin mamaya konti yung numbers that are relevant. So the numbers that will flash naman, whether you're trying to set an appointment in the clinic or just to do a teleconsultation, pwede po for both. So at least may option kayo. And then, ito Doc, this is funny kasi yung pagkakasabi niya. Lastly po, magkano po yung damage?
So, after natin ma-check, no, usually pag yung patients for surgery, hindi yan pwede sa teleconsult. Definitely, kailangan ma-check ka muna sa clinic. So, after ka ma-check, i-assess natin kung ano yung kailangan gawin. When it comes to cataract surgery, iba-iba kasi yung lens na pwedeng piliin ng patient. So, when it comes to the lens, when it comes to the machine that we will use, iba-iba din yung costing yan. So, after kayo makita sa clinic, i-refer namin kayo sa surgical coordinator. Tapos sila yung magbibigay sa inyo ng itemized costing kung magkano yung damage.
Oo. So yun, siguro, alam mo yung Doc, narinig ko madalas sa mga doctors when it comes to preparing for surgery. Ang lagi nilang sinasabi, kung kaya mong bumili ng cellphone, kaya mong surgery.
Tama yan. Kasi kung kaya mong bumili ng cellphone, why not invest in something for your eye, di ba?
That's right. And you're gonna use it for quite a while. You want to enjoy seeing your family, being able to do things independently.
Correct.
So, yun ma'am, whenever we get asked kasi about cost, ang dami kasing factors that we have to take into account. Yung sinasabi ni Doc that when it comes to yung lens, depende kasi sa gusto nyong mangyari. Sasabihin sa'yo ni Doc, ano ba yung priority mo? Basta okay lang sa akin na basta malinaw na after yung cataract surgery, pero okay lang sa akin mag-reading glasses. So, iba yung lens nun versus sasabihin mo kay Doc, alam mo, Doc, ayoko talaga nagre-reading glasses, nakakainis siya. Ibigyan mo ako ng lens na will do everything for me. Yun, magkaiba rin po kasi yung costing nun. So, what Doc will be able to do for you is we'll check what kind of lens is possible, explain niya yung procedure sa inyo, and then kayo yung mamimili at the end. And at least very comfortable kayo with what will be done and also with the kind of lens that you will get at the end. And then, here Doc, there's another question is, meron po akong detached retina since January pa. Meron pa kaya akong pag-asa sa pagpapa-opera?
Yung ganitong cases, this is another case na hindi natin pwedeng i-teleconsult, no? Kung talagang detached retina yung problem mo, kailangan natin makita yan sa clinic, ma-examine. Tapos, it depends eh. Ang sinasabi natin pag may mga retinal detachment, kung hindi mo ipapa-opera yan, kung papabayaan mo lang, mabubulag ka rin in time, no? Pero kung ipapa-opera mo yan, may chance na kung ano yung nakikita mo ngayon, yan pa rin yung makikita mo or mag-improve ng konti. We really don't give high hopes for patients with retina detachment kasi usually it's impossible to bring the vision back to 2020. So the sooner the better na makita ka namin sa clinic, the better yung prognosis or yung outcome ng intervention natin sa'yo.
Okay, so I think that's good advice. ipa-check up niyo na po yan ulit. Kasi
Yes.
lalo na ngayon, siguro yung pinaka-benefit of being in this situation is that a lot of people are working from home instead of having to go to the office. So kung kailangan mo man magpa-surgery at magpahinga sa bahay, yun naman talaga yung state natin ngayon eh. So if you need the surgery, at least you'll have additional time to be able to recover. And then here, Doc, another question is, my mother had an operation with cataract. Few months lang po malinaw na malinaw ang kanyang paningin, but after a few months, balik po sa malabo ang mata niya. Mas malabo pa po kaysa sa dati. Medyo mahirap din siyang magkaroon ng match sa grade ng salamin.
Okay. So yung cases na ganito, maraming factors eh. Pwedeng maayos yung surgery, kaya malinaw after the surgery, pero pwedeng may nangyari sa cornea, pwedeng may nangyari dun sa mismong lens, or pwedeng may problem sa retina. Again, pag yung cases na ganito, it would be best to see us in the clinic para ma-examine natin what really happened. And then, i-address natin kung anong part ng mata yung nagka-problem, yun yung i-address natin.
Okay. So, it's good advice to be able to get checked. Siguro kasi dahil na-enjoy niya yung malinaw na paningin, biglang bumabo. Parang natakot siyang bumisita sa doktor na, no?
Tama, yes.
So I think depends on yung situation ng patient. For a lot of people, what they do is, babalik sila dun sa doktor na gumawa ng cataract surgery. Kasi yun yung nakakaalam kung ano yung ginawa eh. Alternatively, gaya sa sinabi nito, is you can get a second opinion. Find out through a different assessment. Let's say, magpa-check up ka kay Dr. De Jesus to see, baka it could be something else, baka pala retina problem na yung nangyayari. That's why nagkaroon ng panlalabo. In either case, the suggestion is, pa-check pa rin natin kasi medyo mahirap na po na pati sa pagsuot ng glasses, nahihirapan na siya kasi hindi na siya napapalinaw.
Tama.
And then here, another question. My eyes feel dry and I have eye strain after a day of using cellphone. Ay, okay, Doc. Sounds like dry eyes to me.
Same lang din ng first question natin, no? Mukhang nagka-eye strain din siya at saka dryness. So, best is to minimize again screen time at saka gamit tayo ng lubricant eye drops.
Doc, is it also advisable na let's say, nararamdaman mo na medyo nafa-fatigue na yung mata mo, is it a good idea to kind of stop using your gadget and then maybe wash your face? Ganon?
Better to just close your eyes na lang. Kasi yung eyes natin may natural lubrication yan eh. So when we blink or when we close our eyes, nalulubricate yung mata natin. Yung sinasabi ng iba na parang binabasa nila yung mata nila, it's not really the best thing to do, no? It would be better to just close your eyes or use any eye drops.
Okay. So yun, at least we know. And I'm sure kasi someone might ask, ay Doc, baka naman napapasma yung mata ko. That's something I hear about. So, is there such a thing as pasma sa mata?
For me, parang wala namang such a thing na napapasma yung mata.
So yun, it's much better just close your eyes or gumamit ng eye drops.
Oo, more of eye strain yan or napapagod lang yung mata. Ganun.
Okay. And ito, Doc. Hi po, I'm watching your FB Live. And here's my daughter. Paano po dapat gawin? Hindi po kasi kami makapagpa-check up. Mahina po immune system niya. Baka po makawaan ng COVID pag po inilabas ko po yung yung kanan na mata niya po nakatingin sa kabila habang yung kaliwa nakatingin po sa hawak ko. Pwede po ba magpa-consult online and will pay online?
Pwede tayong mag-teleconsult, no, with one of our pedia-ophthalmology specialists. Pero sa tingin ko, ire-require din kayo talaga na magpa-check sa clinic eh. Kasi kailangan makita yan agad. It's better to address the problem early para makorek pa natin. If you're concerned about yung safety naman, yung mga clinics naman natin ay well-equipped. At saka, iilan lang yung sinischedule natin in a day. We don't fill the slots talaga like before. So rest assured that we have put all the necessary precautions in place. It would be best na makita siya as soon as possible. Okay,
so yun. At least we'll be able to show you the contact numbers and you can make a call. Kung mas comfortable kayo na magpa-teleconsult pa rin muna, it's still possible. But again, the doctor was saying already na mas mabuti na rin, mainam na rin po na maipapa-check na yan na in person. So, naiintindihan naman natin na meron talagang fear, lalo na nararamdaman yung immunocompromised yung bata. So, we'll try to find ways to be able to bridge
Yes.
yung ganong concern. Pero rest
Mm-mm.
assured na basta't bumisita sila sa clinic, gagawin naman natin lahat ng maaari at pupwede para maramdaman yung safe ang pagbisita ninyo. And then here, Doc, there's another question naman from Miss Telma. Good afternoon po. Nagkaroon po ng floaters ang left eye ko last Saturday.
Okay. Yung floaters na yan, Audrey, is very common. After dry eye, isa yan sa most common complaint ng patients. And it's common because it can happen to everyone who is already getting older. Two things, no? Ang floaters kasi, it can be something na benign, which is just because of aging. Tumatanda tayo. It can be as normal as getting white hair or gray hair. Or the second thing, it can be a symptom pointing to something more dangerous, such as a retinal tear or a beginning retinal detachment. So, we can't say na floaters lang yan. It's better na makita namin kayo sa clinic. Pag nakita namin na wala kang any retina problems, well and good, it's because of aging, it's because of your vitreous getting older, no? But if nakita natin na may tear or merong nagsa-start na detachment, ma-address na natin agad yung concern at saka mabibigay na natin yung appropriate treatment, no? Kasi very common yan na floaters lang tapos nakita namin may tear. Pag may tear, we do laser agad eh. Kasi pag hindi mo na laser yan, malaki yung chance na maging detachment yan. From an outpatient na very simple 5 to 10 minute laser procedure, baka mauwi sa surgery yan kung napabayaan yung retinal tear. So, ang very important, floaters can be something which is very benign or it can be something that can lead to blindness. So, wag natin babaliwalain. Ang advice ko kay ma'am is, again, you have to see us in the clinic for a dilated retina exam. So, don't forget to bring your companion with you.
Okay. And then ito naman, Doc. Will the teleconsultation be added or recorded into my patient file?
The actual teleconsultation, yung video at saka yung usapan natin, usually hindi namin nire-record yan. What we put in your file is after natin mag-usap, mag-enter ako ng notes doon based doon sa history, doon sa questions na tinanong ko sa inyo at saka sa nakita ko. Yun yung i-enter ko doon. I will enter doon sa file mo yung diagnosis mo, yung problem, at saka yung medications and advice na ibibigay ko sa'yo.
So kung sakaling bumisita sila sa clinic next time, makikita naman
Yes,
na yung
makikita.
Ayun. So yes, ma'am, nire-record naman po yung sasabihin ni doctor sa inyo. And then ito, next question is, is dizziness a symptom of having a cataract?
Usually, ang dizziness kasi it's very vague, eh, no? Pwede rin siyang because of a systemic problem, eh. Ang most common symptom ng cataract would not be dizziness. It would be blurred vision.
Okay.
Actually, if the cataract is also significant, it would be blurred vision which is not corrected with glasses.
At siguro baka yun rin yung nagiging dahilan kung bakit sumasakit naman yung ulo niya.
Pwede rin. It could be. Oo. Pero dizziness as a symptom kasi it's very vague, eh. Kaya it's hard to say if it's because of the cataract that's causing the dizziness.
Okay, so baka ang mangyayari niyan, Doc, parang process of elimination. Pwede niya pa-check yung mata niya to see if the problem is there. If it's not that, then they might be referred to a different type of doctor.
Yes, pwede rin yang sa tenga nang gagaling.
Balance naman, Doc.
Balance naman, correct.
Okay. And then, Doc, there's one question. Can teleconsult pwede bang for eye refraction?
Hindi natin magagawa yun eh. Kailangan yung actual patient nandun sa clinic to get your eye grade. Hindi natin pwede gawing online ang getting your refraction eh.
So unfortunately, wala pa tayo sa punto na pwede yon. Siguro our capabilities sa industry aren't there yet. Pero yun, that's something that you can do. Single visit to the clinic. Tapos kapag kailangan mo siguro ng second pair of glasses, at least may record ka na. Pwede mo na lang pagawa, pa-deliver mo na lang sa bahay.
Correct, yes.
And then here, Doc, sabi ni Charles, my son always na-irritate yung eyes niya and watery.
Pag sa mga bata kasi, common din ang dry eye, lalo na kung lagi sila nagagadgets, laging minsan dahil sa alikabok pag naglalaro sila. Pero meron din kasing condition sa mata na yung pilik mata ng bata pwedeng naka-turn inward eh, instead of outward, which is causing irritation. So isa yun sa worst case, no? siguro kung itry nyo yung mag-lubricant eye drops siya, tapos hindi pa rin nare-relieve, better na to see us in the clinic para makita natin kung ano talaga yung cause. Just like any teleconsult, no? Kung napansin yung hindi nag improve yung condition or yung complaint nyo with the medications we give you can call us again for follow-up. And then if we see na kailangan nyo talaga ng clinic consult, kahit na dry eyes lang yung complaint nyo, we would advise you to go to the clinic. Kasi baka nagmamanifest siya as dry eye, pero there's something else happening na.
Okay. And then how about this, Doc? Ito, open po ba ang Asian eye sa trinoma? Ano po ang mga requirement kung doon pupunta? Gusto ko po kasi na kaharap yung doctor ko.
Yung Trinoma Clinic is open, just as well as our other branches. It's all open now. Very, mas shortened lang yung clinic hours. So what I would suggest is to give us a call muna para hindi naman sayang yung pagpunta nyo and then set an appointment.
Okay, so all the requirements naman will be advised to you through phone call. Ganon din lang yung sinabi ni Doc kanina. Pagkatawag, magpapa-appointment, and kailangan lang po may COVID-19 screening. And remember, of course, remember to wash your hands and wear a mask.
Correct.
And then ito, Doc, from KSL, my sister's 20 years old, highly myopic, approximately 900. Planning to undergo LASIK. Okay, and after the surgery, may chance po ba na magka-problem sa retina?
First of all, yung grade niya na -9 is very high, no? Very nearsighted yung patient. Yung ganyang patients without glasses, hindi yan makakakita ng malayo. Very dependent sila sa glasses nila. And then, first of all, the patient is 20 years old, so kailangan muna natin mag-undergo ng tinatawag na refractive screening sa clinic. So definitely, kailangan pumunta sa clinic. Kung papasa siya sa refractive screening, with regard to the question na may problem sa retina, ang isang part kasi ng refractive screening is retina check, no, by one of our retina specialists. Pag pumasa siya doon, kung pumasa siya sa lahat ng parameters ng refractive screening, kung sinabi ng retina specialist na clear siya to undergo the LASIK surgery, then she will undergo the LASIK surgery. However, yung clearance from the retina specialist to undergo the LASIK surgery does not follow until post-surgery. Kasi after the surgery, many things can happen eh. Pwedeng maganda yung retina niya before surgery, tapos after surgery, since high-risk patient siya, no, with a -9 grade, pwedeng magkaroon siya ng retinal tear eh. Okay. So, right after that, i-follow up pa rin namin yung patient. After the surgery, you will be checked by your refractive surgeon, and then you will also be referred back to your retina specialist. Para on the earliest sign na mayroon kang retinal tear, magle-laser na tayo kaagad to prevent any further damage to the retina.
And siguro for this particular patient, another thing that I hear from the LASIK doctors naman is that it could be na hindi LASIK yung tamang procedures for you. It could be something like yung ICL, which is more geared towards patients na medyo mataas talaga yung
very high grade. Yes, correct.
So in that case, that's why mahalaga na makapagpa-refractive screening ka. Kasi after that, sasabihin ng doctor sa'yo kung ano ba yung best course of action, ano ba yung safest way to do it. And again, afterwards, siguro yung misconception for us is, nakapag-surgery na ako, okay na ako. Hindi na babalik.
Yes, yun ang mali.
Oo.
Most complications happen kapag hindi nagpa-follow up yung patient eh. Lalo na yung mga after cataract, after LASIK, kasi very happy na sila sa vision nila eh. So akala nila hindi na kailangan mag-follow up. Tapos babalik sa amin after a few months, meron na palang naging problem. So mas maganda, susundin nyo yung follow-up schedule na ibibigay ng doctor kasi we know that's what's best for you.
Okay, so yon, maging masunurin na lang kayo, Doc. Siguro yung advice niya. And ito, Doc, saan po ang nearest clinic to go in Metro Manila?
Actually, in Metro Manila, marami kaming branches, no? From north to south, marami kami like Trinoma, Rockwell, Alabang, meron din kami.
In Mall of Asia.
Mall of Asia, yes.
So again, there are a lot of options. Give us a call. We'll try to help you out for that. And then here, from Rowena, ask ko lang po kung ano ang cost ng namamagang talukap ng mata for my daughter, 11 years old.
Pag ganyan, pwede tayo, this is one example na pwede nating i-teleconsult, Audrey. Kasi kailangan natin yung history, kung kailan ba nagsimula, ano pa bang ibang associated symptoms. Pero some common diagnosis for namamagayang taluka, pwedeng may allergy, pwedeng may infection, as common as an insect bite. Minsan pag natutulog, nakakagat yung eyelids natin ng maliliit na insects, ganun, no? So it's better to see the doctor kasi kung sasabihin lang na namamagay yung talukap ng mata, very non-specific eh. Maganda makapag-teleconsult para your doctor can ask you more details on why namamagay yung talukap ng mata niya.
Okay, so yun. And then, Doc, it's here. Yung anak ko, 6 years old, laging sumasakit ang mata nila, parang tinutusok daw. Tapos, pag sumakit, namumula po, umiiyak sila kasi parang natutusok.
Marami kasing causes again ang eye pain, just like eye redness, no? Yung case niya, mas masasuggest ko, better pumunta na siya sa clinic kasi aside from getting the history, making the complete examination, baka may kailangan tayong tests na gawin. At saka we also need to check the pressure ng mga patients na nagpe-present with eye pain. Ang eye pain pwedeng as benign as just dry eye or it can be as bad as having glaucoma, wherein tumataas yung pressure ng mata, causing eye pain.
Okay. So yun, so this particular case, mabuti na mapacheck yan.
Yes,
and then, Doc,
correct.
here, this is an interesting question. Heto po, ang problema ko sa mata ko, yung right po, 2 times na po nalagyan ng lens, yung isa, macular hole. Tapos yung isa, cataract ngayon. Cataract. Ngayon po, parang lumalabo.
Yung first problem kasi niya, because of the macular hole, hindi kami naglalagay ng lens dun for macular hole. So, baka iba yung pag-intindi ng patient. Yung pangalawa naman, because of cataract, yan, tinatanggal yung cataract tapos pinapalitan ng lens. Tama yun. Pero yung sinasabi niya na twice na napalitan ng lens, it would be best na pag nagpa-check up sa clinic, dalin mo yung operative record mo para makita talaga natin kung ano yung ginawa sa'yo.
Okay. So yun. And it's good advice na you keep records of all your medical procedures done.
Yes,
kasi
especially surgeries.
Dalin mo na lang para siya mismo yung magpapasa. And then here, how does Asian Eye check or screen COVID? Siguro, how do we do COVID-19 screenings? Maybe that's what they mean.
Usually, yung patients namin, pag pumupunta sa clinic, nire-require natin ng COVID-19 test, no? Pero kung hindi mo mapagawa, alam ko Asian Eye also offers the test dun mismo sa certain sites So, it would help if you would call first kung ano yung sites na nag-o-offer nitong screening.
Okay.
Para dun ka makakapunta na clinic, yes.
Okay, so I think it depends siguro what they mean. Kasi if yung tanong niya ay paano ba ano ang COVID-19 screening na Asian Eye, it has more to do with pag dumating ka, meron tayo nung temperature check and then meron yung COVID-19
questionnaire.
Yeah, it's a questionnaire where we try to figure out where you've been, if you are experiencing other symptoms. So other questions that have to do with your exposure. Kasi lalo na, let's say, bumisita ka na isang ospital prior that handles COVID-19 patients, then that's something that would be important for us to know. Or let's say nakatira ka sa area that is a hotspot. Or let's say you've traveled recently. So yung mga items na yun, we would have to check, we would have to find out. Para during your checkup, we would be prepared also. Kasi of course, all the doctors and the staff that you meet will be suited up, naka-PPE po lahat yan kasi we're trying to keep you safe. At the same time, para you also feel safe when you're visiting us. And if you do need a COVID test, like a rapid antibody testing, usually that's for patients that have to undergo surgery. So, bago ka makapagpa-surgery, bago tayo magsimula, kailangan po talaga ng rapid antibody testing. It's just as an additional safeguard. Just to see kung meron po kayo ng antibodies. Kasi in that case, kung sakaling nag-positive po kayo sa ganong test, ipopostpone muna yung surgery para makapag RT-PCR test po tayo. Para lang ma-confirm. Para just, again, it's to be safe. And then here, Doc, here's another question. Left eye ng anak ko, blurred vision na po. 18 years old siya. Ano po temporary remedy dapat gawin niya? Gusto ko po sana dalhin dyan sa Asian Eye, but problema po, we're living in the province and takot po kami lumabas because of this pandemic.
Mm. When it comes to blurred vision kasi na ganyan, kailangan talaga ma-check sa clinic eh. Ang first step is i-check natin yung grade nung anak nyo through refraction. And then if makorek siya through refraction, baka error of refraction lang ang problem na nakokorek ng salamin. If hindi naman, baka merong ibang problem sa mata na kailangan natin i-check talaga sa clinic.
Okay. Sige, so siguro yon, yes, we have to be careful of the pandemic. Kung malaking concern na po yung sagrado, it's an option. We can just try to be safer kapag bumisita po kayo. And then here, there's a question here, Doc. May branch po ba kayo malapit sa, I think this is San Jose del Monte, SJBM.
Mm-mm.
Okay, so that's near. Sige, siguro for this patient, I would suggest you give us a call. Kasi we do have, within our network, meron kaming clinic that is in Fairview. So I think that's the nearest branch. But please give us a call and we'll do the referrals needed. Ito, Doc. About polypoidal choroidal vasculopathy, ano po ang best na gamot?
Usually kasi yung mga conditions na ganyan, no, yung PCV, it is a condition sa retina. Ang treatment usually na ginagawa namin dyan is either laser or gumagamit kami ng anti-VEGF injections, which is yan yung mga binanggit niya, yung Eylea, Lucentis, or Avastin. For me, mas gusto ko sanang makita muna yung patient sa clinic, tapos magawa yung mga diagnostic tests sa kanya, such as an angiogram, an OCT, bago ako magsabi kung ano yung treatment na best na gamitin natin.
So yung mga gamot na to, Doc, there is a preferred or recommended medication depending on what you see kasi during the checkup.
Yes, oo.
Okay, so iba-iba talaga. Hindi siya parang apples to apples.
Yes, at saka it's not for all patients. Not all patients are the same. So talagang tailor-made lahat ng decision sa treatment na binibigay namin sa patients.
Okay. And then here, Doc, from Minnie, ano po kaya alternative ointment para sa mata ng mother ko na may stye? Lotepradnol, etabonate, and tobramycin 0.005 milligrams po ang reseta sa kanya dati pero wala po mabilhan ngayon kahit sa drugstore.
First of all, kailangan natin malaman kung active pa ba yung stye or yung infection ng patient or hindi na. So, mas maganda, ito pwede natin i-teleconsult to, tapos i-advise namin kayo, first of all, kung kailangan pa ba maggamot or hindi na. And then secondly, if kailangan mo ng gamot, we will give you the prescription for that.
Okay. And siguro with this particular patient, it might be useful to actually do the teleconsult, no, Doc? Para at least makita clearly.
Correct.
And siguro, it's also good to also give us a call kasi yung pagpapadeliver ng gamot, we'll find out through teleconsult. Baka pwede namin kayong matulungan through our own pharmacy delivery. And then here, my problem is that my right eye was operated for cataract surgery 2 years ago. Now I experience blurred vision. Do I need to go to an optometrist for new eyeglasses? My left eye was also operated for cataract 1 year ago and okay naman compared sa right eye.
It would be best not just to see your optometrist but also your ophthalmologist, your eye doctor. Kasi you underwent eye surgery. Aside from the grade, we also need to check kung okay pa ba yung surgery ng mata mo. Kasi yung lens na nilagay natin, pwedeng nagiging blurry yung capsular bag na pinaglagyan natin ng lens, baka yun na nagkakos ng blurred vision. Yung mga ganong concerns or causes, hindi natin mapapaubaya sa pagsasalamin lang. Kailangan natin ng intervention which will be given to you by your eye doctor. So if you see us in our clinics, you will have an optometrist who will check your grade and then you will be seen by your eye doctor there. Okay,
so at least you hit 2 birds with 1 stone. Kung kailangan mo ng salamin, then you can get the glasses or have your lenses changed. And if meron tayong concern kung sa actual cataract procedure, or maybe it's something else, at least you can see your eye doctor, your ophthalmologist.
Mhm.
And then here, from Miss Bless, may floating po sa mata ko yung parang sinulid na itim na gumagalaw, tsaka meron pong white na nakaharang. Magagamot po ba ito? 58 years old.
Ah, yan is a case of parang floaters na naman. So, pag ganyan, it would be best to dilate your eyes para ma-check natin kung ano yung cause ng floaters mo. Again, if
Mhm.
it's something benign lang or it's something that needs to be treated. So, it's best na makita natin yan, and then kung ano yung makita natin sa clinic, we would advise you on what the next step would be, kung ano yung treatment natin. Sometimes kasi, pag yung floaters is yung benign cause lang, which is because of aging, we don't give any medications for that kasi it's really part of aging we can't do anything about it.
Okay. So, depende po sa cause kung ano yung magiging treatment na suggest ni doctor.
Mhm.
Ito, Doc, I think is also an interesting question. I have rhinitis and I also have dry eyes. What should I do?
For the rhinitis, of course, you need to see your ENT specialist, no? Para ma-address niya yung rhinitis mo. When it comes to dry eye, if it's really dry eyes that you're experiencing, lubricants ang ginagamit natin for that.
Mm-mm. Kasi in this case, Doc, from what I understand, rhinitis kasi can also cause you to tear up kasi allergic reaction siya.
Yes, pwede rin. Pwede siyang on top of the other. Pwede rin.
So I guess ganun din. It's better to just get checked by both doctors to figure
Yes.
out. Kasi baka kapag na-treat niya yung rhinitis mo effectively using medication, baka mawala yung
Yung dry
tearing of
eye.
the eye.
Yes.
Okay. So yun, I think that is our last question actually for this afternoon, Doc. If
Okay.
anyone else has... Oh, okay. Meron pa nagpahabol, Doc. From Darwin. 25 years old po ako, then banlag yung eyes. Ma-eyes pa po ba at paano treatment at magkano?
Yung patients kasi na ganito, kailangan natin kunin yung history, no? Kung 25 na siya, tapos banlag siya, hindi tayo sure, baka hindi na nag-develop yung isang mata niya. Kasi as I said earlier, kapag hindi mo na-address yung mga cross-eye or mga banlag sa pagkabata, usually hindi na nagde-develop yung eye na naka-deviate. So, ang pwede nating gawin kapag talagang pangit na yung vision dun sa isang mata, aayusin na lang natin aesthetically. May surgery na ginagawa para mapadiretso yung mata, pero hindi natin magagaranti na lilinaw pa yung vision ng mata na naka-deviate. Pwede nga siyang diretsyo na, pero pangit yung vision. Tapos, ang treatment dyan is usually yun nga, may surgery. Aayusin natin, outpatient din yan. Tapos, yung cost, again, i-refer namin kayo sa surgical coordinator namin for the costing.
Okay, for this, Doc, is it possible, kasi sinasabi niya 25 years old siya, pero hindi niya binanggit kung matagal nang banlag yung mata niya or biglang nabanlag. Is it possible na maybe you're in your 20s, tapos merong mangyari that would cause the pagkabanlag?
Actually, that's a very good question, Audrey, no? Kung mula pagkabata pa siya banlag, this is not really an emergency. It's more of yung appearance na lang ng mata niya. At saka hindi na rin tayo masyadong aggressive sa treatment kasi by the age of 25, tapos na mag-develop yung mata natin or yung visual pathways. So, it's irreversible kapag nangyari yon, hindi na natin mababalik yung vision. Interesting because kapag sudden onset naman yung pagkabanlag ng mata, this can be an emergency. Usually, nire-request natin ng cranial MRI yung patients na ganito because baka merong tumor sa brain or sa visual pathway ng patient. Kasi very common yan. Kunyari, one day, very normal yung mata mo, tapos you wake up the next day or during the day, bigla na lang nag-cross yung mata mo. Pwedeng may tumor dun sa visual pathway pag sudden onset na deviation ng mata. Pag ganon, we have to be very aggressive and then we have to request for a cranial MRI for patients like this.
Okay. So again, it would depend entirely on the medical history of the patient.
Yes.
At mahalaga na makapagpa-check up siya sa doctor.
Correct.
Okay. So yun, actually, those are the questions that we have for this afternoon. And kung sakaling may mga gusto pang magpahabol or may tanong kayong maisip mamayang gabi siguro habang kumakain kayo ng dinner, you can still send us a message and we'll try to address those questions. And then siguro, Doc, for those who want naman to try the teleconsultation service, when can they set an appointment with you, Doc?
Usually Monday to Saturday, I am available from 9 a.m. to 3 p.m. in the afternoon.
Mm-hmm. Okay, and in the clinic siguro, Doc, you also have some available clinic days if they want to see
Uh,
you in person.
Usually, I hold my clinic now in SM City Fairview. We have a clinic there. I'm there
Mhm.
every Thursday and Saturday from 10 a.m. to 3 p.m.
Okay, so again, within our clinic network, there are a lot of options para kung gusto nyo makabisita, yung pinakamaganda siguro feature siguro particularly of a lot of the clinics kasi where we're present is that a lot of the malls also have their own COVID screenings. They also have their own safeguards in place. So kung sakaling kailangan talaga makapagpa-check up, at least you know that the places that you're present in are also doing their best to try to keep you safe whenever you do your visit. And then here we're flashing the numbers that you can call when you're trying to set an appointment with us. So these are cell phone numbers and you can also send us an email. And for those that are more comfortable na sa social media na makipag-usap sa atin, then sure, send us a message through social media. We'll set your appointment for you. And then for those naman with other eye concerns, just give us a call. Don't worry, we'll try our best to answer all your questions. And Doc, for you, thank you so much for joining us this afternoon.
Thank
Salamat
you
din
also.
for our viewers. Oo, for always watching our Facebook Live. Siguro first time ni Doc sa Facebook Live, so this is a new
Yes.
experience for you. So again, please stay safe, everyone. And if you do go out, please wear a face mask and continue to practice social distancing. So
Thank you, Audrey.
thank you, everyone. See you next time.
Thank you, everyone.